Hi, my name is Paige Cole and I'm going to talk to you today about diabetes. Here's some background. Diabetes is a metabolic disorder characterized by difficulty in regulating the production or use of insulin. Diabetes is caused by the body's inability to produce regular levels of insulin or by the cell's inability to use the insulin productively. Insulin is a hormone that is produced by the pancreas, and its mission is to bring blood sugar or glucose from the bloodstream to the muscle, fat, and liver cells, where they use it as fuel for the body or energy. So if the insulin does not get to these cells, the body will have a high blood pressure and a decrease in energy. There are 3 types of diabetes. Type 1 is also known as juvenile diabetes or diabetes mellitus, and it occurs mostly in children, teenagers, and young adults. In this type of diabetes, the body makes little to no insulin. Type 2 diabetes is known as diabetes insipidus, and it is mainly in obese people, and the main group used to be obese adults, but since obesity in children is becoming more and more, it's becoming more common in children and teenagers and young adults as well. Type 2 diabetes is when the body's cells do not use the produced insulin properly or effectively. And most people with type 2 diabetes do not know that they have it because the symptoms are so little. Type 3 diabetes is gestational diabetes. This type of diabetes occurs in pregnant women who develop a high blood pressure throughout their pregnancy. Causes. Type 1 diabetes. There is no known cause for this diabetes, although some scientists suggest that it has to do with family history, and that has to do with the probability of a diagnosis. Type 2 diabetes, heredity is also said to have a part in the probability of diagnosis for this type of diabetes, although the most common cause is obesity, diet, and physical inactivity. Gestational diabetes, this type of diabetes is caused by the hormone changes that you experience when you're pregnant and the metabolic demands of pregnancy. These together with the genetic and environmental factors. Symptoms of diabetes. Symptoms include blurred vision, excessive thirst, fatigue, hunger, constant urination, and weight loss. These are some symptoms that I included, but they happen after you've had diabetes for a long time, so it's not symptoms that happen that may want you to go get checked out. It's after you've had diabetes. But as I said earlier, people with type 2 diabetes don't know that they have it always, and so they may experience these after they've had it for a long time without knowing. The first one is eye problems. This includes trouble seeing, especially at night, light sensitivity, and blindness in the near future. Painful sores and infections to the leg or foot, and if they're left untreated, it could lead to the removal of the foot or the leg. Nerves in the body can become damaged, causing pain, tingling, and a loss of feeling, problems digesting food, and erectile dysfunction in the males. Diabetes for a long time can also cause kidney problems, which can lead to kidney failure. A weakened immune system, which leads to more frequent infections, and an increased chance of having a heart attack or a stroke. Treatment. Type 1 diabetes is mainly treated by monitoring insulin levels and or blood glucose levels as well, and facilitating insulin injections as advised by a doctor. And a healthy diet can also help with type 1 diabetes. This also means being conscious of how much sugar and carbohydrates are consumed each day. Type 2 diabetes is best treated with exercise, a change of lifestyle, so this means healthy eating and losing some weight. And there are also some medications that can be taken, but these medications are advised to be taken along with insulin injections. When diabetes goes uncontrolled, it is best cared for by a team of multidisciplinary professionals, medications, goal setting, and regular monitoring for complications. So there has been some cases that I've seen in my personal life where diabetes goes uncontrolled and they end up in a long-term care because they can't get the care that they need on their own or by family members, they need this multidisciplinary team. These are specific medications and related side effects, so please excuse my pronunciation here. There's acarbose. The side effects are gas, bloating, and flatulence. Avandamet, there are no known side effects. This is a mixed medication. So all a mixed medication is that, like it said, they mix medications, but so that you don't have to take as many. So there are no known side effects for this one. Gliclazide, hypoglycemia, allergic reactions to sulfa antibiotics. Glimepiride, is the same, hypoglycemia, allergic reactions to sulfite and antibiotics. Glyburide, the same side effects again. So the ones that have the same side effects, they're very similar drugs in their type. Like there's different types of medications, and these ones are the same type, but they're sold under different brand names, and they may have slower reaction times as well. Metformin, its side effects are nausea, diarrhea, and gas.